10 signs to differentiate the flu from the common cold. The flu and the common cold are two prevalent respiratory illnesses that are often confused with each other. However, both illnesses have distinct characteristics in terms of symptoms and progression, leading to different treatment approaches. 1. What is the flu and how is it transmitted? 1. What is the flu and how is it transmitted? Influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. There are three main types of influenza viruses that infect humans: Influenza A, Influenza B, and Influenza C. Among them, Influenza A and Influenza B are typically responsible for seasonal flu epidemics. The influenza virus spreads through respiratory droplets released when an infected person coughs, sneezes, or talks. The flu virus can also be spread through contact with contaminated surfaces followed by touching the eyes, nose, or mouth. 2. The progression of the flu. The incubation period for the flu usually lasts from 1 to 4 days. Individuals may begin transmitting the virus to others up to a day before symptoms appear, and this can continue for up to 7 days in adults. In immunocompromised individuals, the contagious period may extend to several months. 3. Symptoms of the flu. The flu can manifest from mild to severe. Some common symptoms include high fever, typically above 38°C 100.4 F, often sudden onset and prolonged duration. Headache, severe headache, often accompanied by dizziness and lightheadedness. Muscle aches, body aches, especially in the back and legs. 3. Symptoms of the flu. Cough, dry or productive cough, usually persistent and uncomfortable. Sore throat, burning sensation in the throat, difficulty swallowing. Runny nose, clear or yellow nasal discharge, potentially accompanied by nasal congestion. Fatigue, feeling tired, sluggish, and lacking energy. 3. Symptoms of the flu. Nausea and vomiting, less common but may occur in some individuals. Diarrhea, infrequent but possible in young children. 4. Complications of the flu. The flu can lead to serious complications, particularly in children, the elderly, and those with chronic conditions. Some common complications include pneumonia, inflammation of the lungs caused by viruses or bacteria entering the lungs. Otitis media, infection of the middle ear, common in children. 4. Complications of the flu. Sinusitis, infection of the sinuses, potentially causing headaches and nasal congestion. Respiratory failure, difficulty breathing, shortness of breath due to lung damage. Cardiovascular disease. The flu can exacerbate existing cardiovascular conditions, leading to heart failure or stroke. 4. Complications of the flu. Neurological disease. The flu can cause meningitis or encephalitis, particularly in children. 6. Flu prevention methods. Vaccination. Getting an annual flu vaccine is the most effective way to prevent the flu. Frequent hand washing. Wash hands with soap and water or use an alcohol-based hand sanitizer. Covering coughs and sneezes. Use a tissue or your elbow to cover your mouth and nose. 6. Flu prevention methods. Avoiding contact with sick individuals. Limit contact with people who have the flu. Supplementing with vitamins and minerals. Enhance the immune system by consuming vitamins and minerals. Maintaining fitness. Engage in regular physical activity to strengthen your health and immune system. 7. Flu treatment. Rest. Adequate rest is crucial for the body to recover. Fluid intake. Drink plenty of fluids to prevent dehydration. Over-the-counter pain relievers and fever reducers. Use pain relievers and fever reducers like paracetamol or ibuprofen as prescribed by a doctor. 7. Flu treatment. Antiviral medications. Antiviral medications can help reduce the duration and severity of the illness, but these should be prescribed by a doctor. Treatment of complications. If complications arise, seek medical treatment as directed by a doctor. 8. Considerations when you have the flu. Self-monitoring. Keep an eye on your health and any symptoms you experience. Limiting contact with others. Reduce contact with others to avoid spreading the virus. Wearing a mask. Wear a mask when interacting with others or in crowded areas. 8. Considerations when you have the flu. Practicing personal hygiene. Wash hands frequently. Clean your home regularly. Consulting a doctor. See a doctor if your symptoms are severe or persist. 9. Conclusion. 9. Conclusion: the flu and the common cold are two prevalent respiratory illnesses that can significantly impact an individual's well-being. Understanding the distinct characteristics of each illness helps you differentiate them correctly and receive effective treatment. Additionally, proactive flu prevention is crucial to safeguard your health and that of the community.